Alrighty, well, thank you for joining us today. My name is Sylvia Zenteno, and I'm the Director of Educational Programs and Training here at It's On Us. Today's webinar is part of our Zoom University Survivor Self-Care series. For the series, NDRAPE on Campus and It's On Us have partnered together to bring you the series, which is a virtual course, a collection of webinars, workshops, and more for any student and survivor. In this time of really high stress and uncertainty during COVID-19, we wanted to do something for students and survivors who might be feeling an increased amount of isolation and anxiety, and we want to ensure that students and survivors know that we are not going anywhere. You are not alone. We are here with you, so please make sure to check out any of our upcoming events as part of the series. The link is bit.ly/, in all caps, SAAM20. So on today's webinar, we will discuss the barriers survivors of gender-based violence are faced with on and off campus, specific barriers to reporting for Latino and Latina survivors in relation to historical and cultural traumas, and what these barriers may look like during this global pandemic. So thank you a million times over to our amazing presenters at Casa de Esperanza, Leo, Olivia, and Maria Cristina. Can you please put yourselves off mute and go ahead and introduce yourselves? Thank you so much.
Hello, everybody. My name is Leo Martinez, and I'm a project manager with Casa de Esperanza National Latino Network. And I'm also one of the things that I do with the projects that I manage is the National Resource Center for Reaching Victims. I'm a technical assistant lead, and I work specifically with victims who are limited English proficient or immigrants. And then also I'm a past president and co-founder of a nonprofit organization called Latino Link in Atlanta, Georgia. And I do work with the HLAA, which is the Hearing Loss Association of America here in Jacksonville, where I live.
Hello, everyone. Hello, everyone. I'm Olivia Garcia. I am a public policy and training manager with Casa de Esperanza National Latino Network. I also have affiliate faculty status and teach political science, Chicano studies, and criminal justice, specifically victimology. So I'm very pleased to be here with you all today.
Buenas tardes, good afternoon. My name is Maria Cristina Pacheco Alcalá, and I also work at Casa de Esperanza as a program manager. I oversee the work that we do with campus. We're a technical assistance provider for the Department of Justice, and we provide support to minority serving institutions and provide technical assistance on cultural competence. I'm also a counselor psychologist, and I've been working in campus violence against women prevention since 2006. So it's been a while.
All right, well, thank you so much. And now we will get started. We are going to have a great presentation. And at the end, we're going to have a Q&A. If you have questions throughout the webinar, please feel free to put them in the chat. My colleague, Elvin Bruner Jr., and I will be manning the chat. And if the presenters aren't able to get to your question during the webinar, we'll make sure to go through them at the Q&A at the end of the webinar. Please stay tuned. We're also going to share some additional resources today at the end, including some funny gifts if we have time. So thank you so much. And here we go. I'm going to pass it on to our presenters.
Gracias, Silvia. Thank you. So briefly, we just wanted to share a little bit about Casa de Esperanza and the National Latino Network. We just celebrated our 35th anniversary, well, 2 years ago now, on May. So we've been around for a while as well. Casa de Esperanza, it's located in St. Paul, Minnesota, and it was born out of the spirit of Latina leaders and activists that were trying to figure out how to better support survivors of gender-based violence in the community. So because there was a lack of cultural competence services at that time. So our mission is to mobilize, Latina communities to end domestic violence. And we have 5 core values that are Latina leadership, entrepreneurship, organizational excellence, living free of violence, and then community-driven solutions. And part of our experience and work, it was created a special project called the National Latino Network for Healthy Families and Communities. And we're a national center for violence prevention from the HHS. And our main goals are working public policy, research, training, and technical assistance. So that's just a little bit of ourselves. We are over 50 employees locally and nationwide. And we hope that across this webinar, you learn a little bit about our work and our vision, to help survivors. So could we move to the next slide? So before we started, we thought it would be very important to ground ourselves in the definition of gender-based violence. So here's one from the Woman for Woman. We feel that it's very inclusive, so it basically defines gender-based violence as the violence that is directed at an individual based on his or her biological sex or their gender identity. And it includes physical, sexual, verbal, emotional, and psychological abuse, threats, coercion, and economic or educational deprivation, whether it is occurring in a public or private life or setting. And we also know that, beyond this definition, there are other manifestations of gender-based violence, such as hate crimes, coercion, identity theft, economic restrictions, housing insecurity, family violence. And we could continue mentioning, like this looks very different, depending on the context, the resources, the communities. But I would say that it is something that we see on a daily basis, and we're just not aware that it's violence because sometimes there's so much violence in our communities that we kind of like naturalize it and accept it, and it's hard to make the differentiation of what's right versus what's gender-based violence on a system that historically, there's a lot of patriarchy. So we're going to continue talking a little bit about those things in our next couple of slides. Next slide, please. Okay. So we thought it would be best to maybe talk a little bit about general barriers that any sort of student may experience as a survivor of gender-based violence in a campus community, and then we'll be more specific about some of the challenges that Latino students may face. So generally, and I say this based in our experience as working with over 200 campuses at this point, sometimes there's a general lack of understanding of campus policies and procedures addressing gender-based violence. And a campus may have strong policies, but it doesn't mean that their staff is trained on those policies and understand the impact and the extent of that violence and how that looks like, in the day-to-day life of students. Also, there's a lot of, there's a lack of services on campus. I know that some campuses have counseling services, but if you call them and ask for an appointment, they'll say that they'll give you an appointment in 6 weeks. And that's really unrealistic for someone that's seeking help and that just decided to take that very important and hard step of seeking help and, having to face that barrier that there are no services available. It's, it's heartbreaking, and it's not certainly building the trust that we should have within our campus community. Also, there is a lack of cultural responsive services, and this would apply, to any cultural specific community. Service providers may not look like us. They may not use our same language. They may not understand our experiences and the community challenges that we face. Sadly, there's a lot of victim blaming culture as well. Like, a lot of people still don't understand the complexities around gender-based violence and the history. And also, there's a lot of lack of understanding about the intersectionalities. Like, it's not only surviving gender-based violence, but it is also surviving campus, like completing your bachelor's degree, surviving that first year when you're moving out of your home and then moving to a remote or a different place and just learning about how does that look like. It's also about surviving maybe poverty, maybe other manifestations of violence. So usually service providers tend to work in very siloed ways, and this is more complex than that. And in terms of community barriers, sometimes when we just move to a new community, a new city, we don't know what services are available there. So it's usually hard to make the distinction about what's available, what's free of charge, how do I get there, if I don't have access to transportation. And in terms of international students, what is their housing security, as a community barrier to seek other services. Like, if they don't know what's easily available for them, then how would they know where to seek other services without the fear of facing other challenges that might be more biases and prejudices from services providers? And, generally, a lot of people are scared that they might say, the wrong thing in terms of, being culturally responsive and trauma-informed. People think that talking about culture is something that's divisive, and they don't want to admit that they have their own biases and prejudices. But we all do. We all have them. And that's one of the things that it's important, when stepping up and reaching out, for services, is to understand that we all have those biases, and that includes direct service providers. So it doesn't mean that we need to be patient with them, but it does mean that we need to understand also where they come from and demand our service for a right service, a comprehensive service, like demand a high quality service of someone that can provide a culturally responsive and trauma-informed service for you. And now we're going to pass to Leo.
Okay, so some of the things that we can do is understand a little bit more about what culture is and why culture matters when we're working with survivors who might be Latinx and who are students, and they may have survived, whether it's gender-based violence or whether it's any kind of violence. As we know that in communities of color, sometimes violence compounds, not only as gender-based violence, it might be hate, people might be the victim of a hate crime or victims of bigotry in general, or biases and attitudes from people, and it could be just as little as a microaggression or as big as being a victim of a hate crime. But in general, one of the things is that why culture matters is because it affects everything. It affects the way that people seek for services, seek for help. It does not, it might prevent people from actually accessing services because of attitudes or because of how they were brought up, or how their values, their beliefs, their attitudes, their experience as maybe as a Latino person, as a Latinx individual, their experience maybe if they are immigrants, their experience if they are undocumented immigrants. It does changes how they are, how they feel they are perceived, and how they perceive their world around them. So that's very important that we have to mention. In general, we know that there are a lot of folks in the Latino community, especially those who are immigrant, there's a mistrust of mainstream services or the way that services are provided by mainstream organizations, because we tend to see that sometimes they try a cookie cutter type of approach that it does not fit everybody. So we know that sometimes turns people off, or sometimes it's just people don't trust systems because they have had bad experiences in the past. Some of that stems maybe from historical trauma. If you are, someone is from a country that has maybe was the dictatorship, or the law enforcement was actually doing harm to their citizens, they're not going to go to law enforcement if they suffer from what is a crime of any kind. So sometimes you want to see some attitudes based on that are changing. Immigration status, it definitely affects how people are going to seek services or not, or how they are going to be treated, and access to services. Some people can have access to services, or can have access to some resources based on if they are documented or undocumented. We know that there's also underrepresentation of people of color among service providers, and that also makes a difference based on the perception that I may not feel as comfortable with the person that I have in front of me to confide if I've been a victim of violence. We know that formal systems sometimes do not include alternative resources or things, access to healing in a way that may not be mainstream, and that may not be perceived as something, oh, that's kind of weird. If your grandmother, your abuela tells you, okay, I have a tea for you that I made with herbs, and that's, a way of calming someone. And somebody else might think, well, that's kind of not going to solve my problem, but it does make a difference with someone from a different culture. We know that the number of stresses that people are being exposed to makes a difference. We can tie this to the ACEs studies. If you ever heard of the adverse childhood experiences, where people, especially folks from maybe from communities of color, might be more exposed to trauma throughout their life, especially during childhood, that might affect their health, or that might affect the way that they access services later in life. So, and some people call that social determinants of health. We know language access is an issue sometimes. People tend to go back to their first language if they haven't, a problem or something that they need to disclose. And you would be surprised how much people fall back on their first language. I usually give this example. I'm not a good flyer in general, even though I tend to fly a lot. Not right now, but when I fly, if there's a little bit of a turbulence, I usually grab myself to the side of the seat, and in my head start reciting the Lord's Prayer in Spanish. And even though I speak 95% of the time in English, I go back to say that in Spanish. And I haven't been Catholic probably for 25 years. So you can see that, with such a silly example, you can see that people still always will go back maybe to their first language. We know also, I think Maria Cristina mentioned intersectionality, and we know that people not only are Latinos, but they might be also Afro-Latinos, they might be LGBTQ, where they might be they might be living with a disability. So all of that also affects how people are going to seek services, or in the manner in which they're going to respond to services. So I'm going to go ahead and pass and move on to the next slide and pass it to Olivia.
Yeah, thanks, Leo. And so it might be really interesting too, because there's a whole different campus culture, right, that we haven't even talked about at all. But Leo, as you were speaking, I was thinking about some of the ways that people might see you on campus is definitely also going to impact, whether or not you disclose, or how you feel comfortable talking to certain people about any kind of violence, violence or harassment that you might experience. So I want to talk about new barriers that students may be experiencing at the moment. So we are in a completely different time, right? Like many of us are experiencing online classes, we're working remotely, which is really odd because as students and faculty, we are used to being around each other and working together. And so with this in mind, reporting gender-based violence, harassment, right? Like what we just experienced in the Zoom bomb, it gets even tougher because there's new barriers. So at the moment, we're dealing with having to respond online and realizing that there's very little in-person services, either on campus and then, as I mentioned, as we've mentioned, within community. We're also seeing concerns around online harassment and what that means. And in many instances, we're having to write some policy around this, right? Like how long does the harassment have to last? What are the evidence that we need to gather in order to be able to report, gender-based violence, dating violence, intimate partner violence, violence against women on campus. We've also heard, as a national TA provider, we've heard about increases of online harassment, bullying, fraud. And so because we're now doing work remotely, campuses are doing online classes, investigations are moving at a little bit of a slower pace depending on your campus. And this is tougher because it's tough to interview other students, right, who might have witnessed behavior now that not everybody's in one kind of central location on campus, on the quad, or, in a particular area. So these are some new challenges. If we could go to the next slide. We're also seeing some of the same barriers manifest in community services, as Leo mentioned. He mentioned a slew of issues that we're seeing at the moment. We're seeing very few in-person services as well, typically only under emergency circumstances. We've noticed that there's a few staff people working remotely, or just a few staff of community resource people working. These community organizations that typically, we can turn to are really underfunded. Now they've had to move funds from running a crisis hotline to making sure that they have enough hand sanitizer and Clorox wipes to keep their staff that is working safe. So folks are really trying to switch around resources at the moment. We're also seeing some mixed information about COVID-19 and community resources. Some places aren't as clear on whether crisis lines or shelters are open, or if counselors are taking new patients, or if telehealth is an option, right? So we're starting to get a bunch of different confusing messages. And then with regards to cultural and historical trauma that may impact campus and community barriers, at this moment, according to medical professionals from the National Hispanic Medical Association, people are dealing with chronic stress, and that might cause or trigger other kinds of medical issues within the body and within families that maybe have experienced violence in the past, and that may manifest in some kind of gender-based or intimate partner violence. So we're now compounding trauma and traumatic experience, also because folks may no longer be on campus and now they have to be home a little bit more. So it's also helpful to think about our international students and students of color that have family abroad and that cannot travel to be back home or communicate as often. And so that's also leading to additional trauma, right? Not being able to contact your support as often or as constantly as you would like. So these are some examples of how cultural and historical trauma may be impacting campus and communities at this time. And I'm going to pass it over to Maria Cristina now.
Thank you. And I think we're talking about trauma and we're not necessarily defining it. But a general definition about trauma is something that impacts you in a way that you get scared of your life, of your family life. It has an impact on your mind and on your body. And then when we talk about historical trauma, it's adding those other components and lenses of history that impact us historically for years. For example, I am a Puerto Rican, and we've been a colony for over 100 years now. And, you know, while I may think I only have X trauma on X experience, for example, hurricanes, we also have the challenge of historical trauma and how colonization affects, you know, the government's process of making decisions. And that has a toll on us right now in our society, and how we make the you know, how we define our needs and how we work with our work plans and address our needs. So here we have a couple of tips for working through trauma and cultural historical trauma during COVID-19. And this is something that we were very mindful when putting together about how this would help not only direct service providers, but students who are survivors of gender-based violence, you know, so this works two ways. And the first thing would be to realize, you know, the impact of trauma, you know, suffering the effects of trauma in the context of gender-based violence has serious repercussions on how we sense life and the world around us. Many people have different reactions, and this traumatic experience, it causes us to reconfigure how we think about people, how we feel about ourselves, how we talk to other people. So we need to realize first that impact of trauma. It can be physiological, it can be psychological, it can be emotional, it can look very diverse. And it doesn't need to be the same for every survivor. Then we need to recognize, you know, the signs and symptoms in our campus community. So because we do live in a patriarchal society, you know, decisions have been made by men for longer than what we might want to. And that is a struggle that we still have, you know. So gender inequality adds a component of prejudice, discrimination, penalization, re-victimization, re-traumatization to survivors. So in the campus context, you know, a student may seek services, and we may think that it's just counseling. One of the things that I advocate a lot is that advocacy is beyond counseling. Like, we need to help survivors and meet them where they are. And that means, for example, that we can talk with a faculty member and ask them to postpone a deadline, or to give a student the chance to retake a test anytime they feel they're ready to. Even giving the student an incomplete and allowing them additional time, months, so that when they're ready, they can come back and take the test and not being penalized because they're seeking help, you know? It is very sad. In most of my experience, sadly, survivors end up leaving campus and starting all over again. And that's not what we want. So in that sense, service providers need to be more creative about how to support students than just delivering a service from the office or the unit that they work in at campus, whether that's counseling center, law enforcement, and we'll talk a little bit about that soon. Then we also need to respond in a way that we ensure survivors feel supported in different holistic ways, you know? Like we said, trauma impacts us physically, socially, emotionally, culturally. So we want to make sure that we are able to anticipate and adapt the changing needs of our campus community and the survivors in our community. And again, we cannot stress enough about the intersectional lens that we need to use to help survivors, because they're just not surviving gender-based violence. They are surviving other things, and they may not be even aware of it. So it's a process, it's an ongoing process, it's not a checklist, and we need to be mindful of that when providing services to students. And, you know, about available resources on campus, I wanted to share this list here. It's not extensive, it's just an overview of some services, but people don't tend to think that these are services that are available for them on campus. So, for example, we have law enforcement. They're there beyond taking a complaint. They can help work on a safety plan. Campus should be able to provide accommodations around allocating a parking that's closer to X or Y building, trying to change dorm rooms. Like, there are many things that they could help advocate for and provide that service. There's also Title IX, and like Olivia say, for some campuses there has been a delay right now, but the it should continue to be happening. Like, campuses should continue to receive the complaints. They should continue investigations as much as they are able to, and it is a right for the survivors to know where the campus is regarding the process that they have. There are also offices about equity and inclusion. If there's something related to the campus staff or faculty, you can also make a complaint there and ask for the right process, and staff and faculty will get trained on these issues. Health services, it's also important because, like we said, trauma is also in our physical and our body, and we may not be sleeping right, we may be overeating, and health services is an office that's on campus that's free to everybody. I still do visit campuses, and a lot of students don't know that that's a service available for them and that it is free of charge and it is confidential. So we want you to know that and to use that service. The counseling center, conduct board, judicial affairs, they also have their own procedures to address gender-based crimes on campus. And when you go and seek services from any of these offices, like, you don't need to go to all of them, but it is encouraged that you work with them to continue visiting the rest of the offices and understanding their responsibilities and their offerings for survivors, because they do offer different things. And depending on where the student is and what is it that they need, you may only need to go to Title IX or to the counseling center. We also have on-campus and off-campus advocates. There's also academic counseling, which again, it's very important. Like, you don't need to take classes at the same point. We can talk with your faculty member. There can be accommodations, like you don't need to drop out of the class or quit the semester. There's also the Dean of Students, ADA coordinator, because if you have like a specific disabilities that needs to be also accommodated for you, that also can be done. There's also student support services. And the names of these offices may look different on your campus, but they're all there. Like, most of these are mandated by federal laws. And most campuses have available like their annual security report on their website. The information for their Title IX office should be very easy at the bottom of their website. So please do take the time to read your campus policies and procedures. They may be very long, they may be very complicated, they're boring, but it is important for you to know your rights, and we're working actively with the administration to make this as simple as possible and to hold them accountable for the work that they need to do. So I'm going to ask Olivia to continue now.
So we put together a few resources, and these are kind of big at the national level. And as mentioned in the chat, the slides are going to be distributed. So we included the National Sexual Assault Hotline number, the National Domestic Violence Hotline number, and then we're including our COVID-19 resource library that has a variety of different resources that are in English and Spanish for immigrants, as well as advocates and survivors of gender-based violence. And so this is a really comprehensive list. And then I'm going to give you a shameless plug to register for our listserv, because through this you get a variety of information about blogs, about policy that's going on that you can impact the way in which gender-based violence, violence against women, intimate partner violence is seen in your local government and even in your state government, and of course nationally. So if you register for the listserv, our newsletter is actually coming out on Thursday, so I encourage you to do that. Additionally, I would, if we could go back one slide, I think it's helpful just to enter these phone numbers into your cell phone and just have them as contact. And so that way, because, you know, what are you going to happen when somebody needs these resources? You're going to have to come back to this presentation, right? Like, I would just encourage you to add them as contacts. And so whenever you need them, you know, I hope you don't, but in case you do, you're already prepared and they're already in your phone. Next slide. I believe that's some additional resources that we can go through. I think Maria Cristina knows these better than I do. Know Your Title IX and Rape on Campus, Changing Our Campuses. The Cleary Center has fantastic data and also some different research and helpful tips that might be useful. The Victim Rights Law Center has some more additional resources. Hollaback, they are providing fantastic training at the moment on bystander, on what to do both for gender-based violence, but also if you see more hate crimes, as we have seen across different campuses. And then of course, it's on us. So I now welcome Maria Cristina and Leo to jump in, and we are also happy to answer questions and have a dialogue as well at this point.
Thank you, Olivia. I just wanted to mention that Sylvia sent us some questions that that some of you posed before when you register for this webinar. So I just want to answer a couple of those, if you all don't mind. One was related to, actually it says, how are we disaggregating data around queer and Latino survivors, and how do the rates of violence differ? And for once, I just want to mention that there isn't enough research being done, and I wish we would have a lot more researchers that dedicate their time to find about survivors in the Latino community, or in the Latino LGBTQ community, or the Afro-Latino community, and all those intersections, because there isn't enough data. Sometimes when we found data, it is not, it's based on partial information, sometimes because organizations like, for example, the National Association of Anti-Violence Projects, which compiles a lot of data around LGBTQ folks and violence, they only get partial data from around the country. They never get everything, because a lot of that stuff, a lot of crime goes unreported. A lot of crime goes unreported in immigrant communities, so we don't have enough data around those. So the more that we can have individuals who are researchers to dedicate to some of these topics, the more information we'll have access to. And the other one that I wanted to, which is really, yes.
Before you go to the next one, I wanted to add that for Cleary purposes, they do need to record the data based on the survivor, and it could be a trans person. The challenge there is that in Cleary, there's not a specific definition for gender-based violence, but it is more about dating violence, domestic violence, sexual assault, stalking, you know, homicide, hate crimes. And for people that want to ask or see more information about their campus, you should be able to see your annual security report on your campus website. And that's a report that should be published on an annual basis by October 1st.
Thank you, Maria Cristina. Yes, what I was mentioning was with the communities at large, not within campus. And the other question is about it was about male survivors, and how do we make sure that we have a like an all-gender approach when we're working with survivors? Because even though we know that the majority of victims are female or female identified, we do have some survivors who are male or male identified, and we should be able to make sure that we have an all-gender approach when we provide services, and that any service provider, whether they are on campus or off campus, that are able to work on their biases, make sure that they, first that they believe survivors, that they hear their stories, and that they are able to provide services. We know we have heard a lot about and what I was mentioning earlier about culture and how that affects our ideas, especially ideas of masculinity, and what is masculinity and what is actually healthy masculinity. And that affects sometimes male survivors coming forward and reporting if they've been a victim of a sexual assault or domestic violence, or reporting what is their experiences and being able to seek services. And all of this is actually comes from our gender role socialization when we're kids, and it's the same gender role socialization that causes the same issues with homophobia, transphobia, and so on and so forth. All these isms that comes from early on in our lives. So.
It's also worth mentioning, I just put this in the check box. So part of the reason that we don't have enough information, right, even though it's supposed to be reported, we know that many of these instances are not reported. So as researchers, when we're looking for like, you know, some big data or some big research, we're really limited on where we can go. I've seen great work out of Professor Lynn Eddington out of American University, who's trying to combine data from 3 different data sources to try to analyze LGBTQ violence around young people 18 to 24. What we know, you know, from the data and from the practitioners that are on this call is that usually the first disclosure is to a friend or to a family member. And that's where it becomes really important for you all as advocates, right? You don't know it, but you're advocates, to have some of these resources already in your back pocket or on your phone so that you can help whoever it is whenever they disclose to you.
Okay, it sounds like Sylvia, you may have other questions for us from the chat or from other folks.
Yeah, thank you everybody for the great questions that we've had. Some of them have been answered, and thank you to our amazing speakers for answering them in the chat throughout and multitasking. We have a couple more, and since we have a little bit of time, I can just give you those questions. Someone asked, can you share specific ways to be more culturally responsive that we can share with campus leaders? What are ways we should think about serving our Latinx students that is culturally responsive versus ways that may be approached overall?
I can go ahead with that one. It is very important to be culturally responsive, but also we recognize that not all institutions have that capacity. Therefore, our recommendation is always to find who are your community partners, including who are culturally specific organizations that can support the work that you do on campus and that can talk to you about that community that they represent. One of the examples of the work that I've done that I am very proud is one campus in Florida. They do have a lot of homeless students in their community, and we were working with them into strengthening their coordinated community response. So they were creating that team, and I was telling them, do you know that there are statewide homeless coalitions that provide direct services to these communities and that have resources to do other work? And they were, no, we didn't know, but they're not related to gender-based crimes or violence, so why we would need to invite them to our table and our conversations? And I was like, you're right, but they're experts on people without home, with housing insecurities. Like, they can bring so much to the table, and they can help you understand what are some of these challenges that your students face. And they did. And that collaboration grew to the level that the coalition was gonna help them build on campus a shelter for homeless students so that they could access services, you know, emergency services at any point when they needed those. And to the point, you know, you don't need to bring in an organization that's expert on gender-based violence. Like, you do need to partner with your rape crisis center, with your shelter, But if you have like a Latino organization, if you have like a specific cultural group in your community, invite them, because they represent something that you don't necessarily have. And it is also important to have the voices of survivors on the table. You don't need to do a checklist of who's a survivor and who's not, and how do you know that they're represented or not. But their voice, it's very important. And that's also why we also encourage to work with students, to work with student body organizations. Like, they know what they need, they know their realities. And, you know, we think that LGBTQ, you know, they do have a lot of things in common, but the LGBTQ students from Georgia are not the same LGBTQ students from Puerto Rico. So while it is challenging, the reality is that as service providers, we need to sit down and listen in an equitable, respectable way. What is it that the students need, and how we can better serve them. And then the other part is that there needs to be an institutional commitment to training and building staff capacity. And this is not just a 2-hour training on cultural competence. Like, we will never be culturally competent, because there are so many cultures and there's so many things to learn every day. I think that by recognizing this diversity is just a start to learn and to have the willingness to change and to do things that are beyond our power to support those students. So I would say ongoing training and significant amount of training. Like, again, like now here for this presentation, we try to get together the most important things that we could think of. But we could be talking about this for a week or more. But if you really want to get to that place where you're culturally responsive, you need to learn, you need to assess what your campus has, you need to have a plan, you need to assess and evaluate that plan, you need to implement, you need to go back again and revise, you need to talk with students and gather their input. Like, it is like a long-term process, and it is a lot of time and effort, but at the end, you'll see the difference. You'll see, because with students' engagement, you'll see the difference if you really make the commitment to respond to them and not necessarily, I guess, work with the institutional interest, which sometimes, more the times that we think of, are in a very different place than where student needs are. And that's another challenge that a lot of service providers face, because they're in this unique position where they need to do their work, but they're not in a decision-making piece or place at their institution. And, you know, that's another conversation, but also it's something important to acknowledge, you know, while we're talking about campus service providers and students. Like, we all have different, you know, challenges where we are. I guess the most important thing is to be willing to learn and to have this meaningful collaborations about what culture means and how it impacts us and how can we improve what we currently do.
Okay, great. It unfortunately looks like we might not have time for other questions, but I do want to say, if anyone still has questions, feel free to keep adding them to the chat, and we're going to record the chat and we can send answers back in our recap email. For anyone who wasn't able to register before today, you can go back and register now and you'll still receive our recap, so no worries about that. All of our registration information is on our social media, so feel free to check any of that at eRock or at It's On Us for any social media. I think that was a really great question to end on because that response was just extremely thoughtful. So thank you so much to our amazing presenters. I cannot say thank you enough. Thank you to Annalise, who will be doing our translation afterwards, and we are going to share widely with as many people as we can a recording of this maybe with some parts edited out, the Zoom bombing, and with Spanish translation in the captions. So again, thank you all so much. Thank you to Elvin, who's behind the scenes on the tech side. Thank you for our partners at NREEF on campus. And again, Maria Cristina, Olivia, Leo, you are amazing. Thank you a million from the bottom of my heart. And everybody have a great rest of your day.
Thank you.
Sylvia, can we add some closing thoughts really quick?
Yes, absolutely. Go for
We
it.
just wanted to highlight two additional points of awareness and celebration. So today is the National Day of Awareness for Missing and Murdered Native Women and Girls. We want to make sure that we honor that, especially in today's webinar, as we had that discussion. And we also want to be mindful that today is Cinco de Mayo, and it celebrates Mexican-American culture, particularly in the Southwest. And so these are 2 points of cultural competency that are really important to highlight. And perhaps if we end there, they might lead to larger conversations.
Yes, thank you so much. We can add that into our recap email and also post that on social media so that everyone has access to it as well. Any other closing thoughts?
Thank you for coordinating this and all your Zoom series. They're very helpful for the campus community.
Thank you all. All right, great. Have a happy Tuesday. Bye-bye.
Bye.
Bye.
Bye, everyone.